Sometimes we must live through the darkness in order to see the light. We must visualize.
Hey everyone, this week I'm going to talk about being admitted to the Children's Hospital and the day of my transplant. So my mom and I went up to Calgary, which is about 2 hours north of Lethbridge, where I'm from, and I had my transplant done at the Alberta Children's Hospital, which is the old Children's Hospital, not the new one. For patients who didn't live in Calgary, they had accommodations at the Foothills Hospital for the families to stay at, but there weren't any available, so my mom and I ended up staying at a travel lodge. And cool fact is, it was the same travel lodge or hotel that they used in the movie Cool Runnings, and it was quite old and a bit gross, but it was a place for us to stay. The night before I got admitted to the Children's Hospital, I had my pre-surgery meal, which was always pancakes for some reason and Chips Ahoy, the rainbow ones, and I would just eat as much as I could because I knew I had to start fasting before my surgery. So the next day I went into the Children's Hospital and I got admitted to the oncology ward and got my room. And they started me on the first of the 10 days of really heavy chemotherapy, and I had it through pills, not IV or anything like that. And I was going to have surgery that first day to get a Hickman's catheter put in my chest, and so they wanted me to have as little of water as possible. So they put all of the pills that I needed to take in like the little pill containers and mixed it with water and called it a cocktail, and they had me just drink it. And so me trying to be the brave teenager I was, I just gulped it down and pretty much immediately threw it back up. But they did it again. I was able to keep it down. When I went in for the surgery for the catheter, I remember the the lady comes to me and she's like, "Hi, I'm Dr. Deb. I'm going to be your I'm going to put you to sleep." And my mom's thinking, this lady has no idea. She can't even pronounce her job. I can't pronounce anesthesiologist that well either, but it's this lady's job and she can't pronounce what it is. But anyway, had the surgery, had the Hickman's catheter, 2 tubes coming out of my chest to make it easier for the transplant, for any blood transfusions or any other fluids or anything I needed. It was really weird getting used to. I had to have that for about a year, and so I had to get used to that. And so after that, started 10 days of chemo. I was in and out of the hospital. I was on a lot of anti-nausea drugs because chemo makes you feel really sick. So those 10 days, I don't remember much. Apparently, I went and visited my brother Paul when he was doing the stem cell donation. I have a vague memory of that. I believe I was in a wheelchair and there's just a big machine around him. I also went and I saw a movie. Can't remember anything, but I was in and out of the hospital because I wasn't quite sick yet. So on February 16, 2001, that was day 0, the day of the transplant. I remember the room was quite full. My parents were there. I believe my grandma was there. My sister Beth and her boyfriend at the time, Patrick, came down, and Patrick likes taking pictures, so he was taking pictures of the whole process. So when they do a stem cell transplant, it's different than a bone marrow transplant. And stem cells, my brother donated, it was pretty much like he was donating blood, but they did it out of the big vein in the neck, and they put it through this machine that separates the stem cells, the red blood cells, white blood cells, platelets. And with the stem cells, when they transfuse it, they pretty much just dump it into your body. So it was a really, really quick process, and they just pretty much dumped it into my body. And I remember I started having trouble breathing, and they put the mask on me, and my mom was laughing because my brother has severe asthma, and of course the first thing I get when I'm getting his stem cells are trouble breathing. The stuff that the stem cells were in to keep it fresh, they had an odd smell to it. They could either, I can't remember, one of the smells was corn, and that's what mine smelled like. I remember I was able to have a pass from the hospital that night, and we went back to the hotel, and we're sitting in my parents' car, and my sister Beth was like, I will never be able to eat corn again because it was just emanating off me. I just stunk so much like corn. So after that transplant, February 16th, 2001, it was just a wait and see. And so we'll talk about that, the wait and see and what happened after the transplant next week. Also feel free to ask me any questions that you might have. Follow, subscribe, share, do anything you want. I'm also asking for those who may live in Australia if you'd be willing to share your story or have me interview you. I know there's a couple of you that do live here with DBA, and I'd love to meet you. So yeah, we'll see you next week.
Sometimes we must live through the darkness in order to see the light. We must visualize.